We see patients of all ages, starting on the young side. The American Academy of Pediatric Dentistry recommends that infants be seen from the age of 1. Not so much for the infants, we can do an exam at that point, but more for patient education to make sure the child is receiving proper oral care as the child gets older. We routinely recommend seeing children from the age of 2 on up. I find in treating kids of that age, when we see them at 2, it's a fun visit in the dentist. They come with mom and dad, they go for a ride in the chair, we count their teeth. My hygienist is great, we play off of each other. Kids aren't always good. The ones that misbehave for her are good for me or vice versa. But we find that the kids are generally great, we love to see them. The one thing I can say is when we start them off at 2 years of age, they get into the system and really respond well. Parents who wait till the age of 4 or 5, the kids start learning that no word, and it becomes a little bit more difficult. We get them through it, but it's just so much easier. So we bring them up through the ranks. I'm at my stage in my practice where a lot of the little tykes that we saw starting off when they were 2, 3, 4 years old are now older, they're married, and we're seeing their kids. That's a bit scary, but it's happy to see they're returning and bringing their families now into our practice. On the other end of the spectrum, I also enjoy the geriatric people. We see people from nursing homes. The 60s of the past are now the 80s, people coming in receiving routine dentistry. In fact, we have patients in their 80s, late 80s, that are having implant work done. So 80-year-olds today are like the 60s of before. Quite a few patients still in their 90s that we see, which are a real kick. We really enjoy seeing them. And I'm happy to say my oldest patient in the practice should have turned this past Christmas, just a few short weeks ago. I believe he turned 102. So that's quite a variety at both ends of the spectrum, but it keeps our life exciting, and like I said, we just look forward to having both ends of the spectrum in the schedule.